So, good morning, ma'am. I'm Honey Grace Arañes, your student nurse from CSPC. And today, I will be doing the procedure of Leopold's maneuver and fundic height measurement. Good morning, ma'am. I'm Honey Grace Arañes, your student nurse from CSPC. So, may I know your name po?
Jimmy Nicole Salazar,
Your birthday po?
January 2004.
So, how would you like me to address you
Jimmy
po?
na lang po.
Okay, ma'am. So, allow me to explain the procedure that we will be doing today. So, our procedure is called Leopold's maneuver. So, it means it has 4 maneuvers. This is important for us to know the fetal presentation and fetal lie on the baby inside your womb. So, is that okay with you po?
Yes po.
Okay. So before we start our assessment, you can first urinate on our restroom so that there will be no discomfort once we start our assessment. We start the procedure po, ma'am. Naiihi po ba kayo?
Hindi po.
Okay, so before proceeding to the procedure, we will wash our hands and provide the client's privacy. So first, we are going to do the first maneuver, the fundal grip. So stand at the foot of the client, facing her, and place both hands on her abdomen. So assist the client into supine position. So ma'am, higa na po kayo. And ask the client to slightly flex her knees. This is to prevent supine hypotension syndrome. Next is place a small roll towel under the right or left hip. So next is stand at the foot of the client, facing her, and palpate the both hands of her abdomen. Palpate the superior surface of the fundus and determine the consistency, shape, and mobility. So palpate it top to the bottom. This is to determine whether fetal head or breech is in the fundus. Next one is we're going to do the second maneuver, the umbilical grip. So first is face the client and place the palms of each hand on either side of the abdomen. So palpate the side. And on the other side. This is to locate the back of the fetus. And now we're going to perform the third maneuver, the pollex grip. So gently grasp the lower portion of the abdomen just above the symphysis pubis, between the thumb and the index finger, and try to press the thumb and finger together. So determine any movement and whether the part is firm or soft. So this is to determine the part of the fetus at the inlet and its mobility. So the fourth maneuver is the pelvic grip. So turn the face of the woman's feet and place fingers on both sides of the uterus approximately 2 inches above the inguinal ligaments, pressing downward and inward the direction of the birth canal. Then, this is to determine the fetal attitude and degree of diction. Next is measure fundic height using a measuring tape from the notch of the symphysis pubis to over the top of the uterine fundus. Then, after that, drape the exposed abdomen. Then, assist the women to get done from examination table. Okay, ma'am, so tayo na po kayo. Then, after that, record findings and women's reaction and perform hand washing. Good morning, ma'am. I'm Honey Grace Arañes from Camarines Sur Polytechnic Colleges, and today I will be doing the procedure of assessing fetal heart rate. Good morning, ma'am. I'm Honey Grace Arañes, your student nurse from CSPC. So, may I know your name po?
Nicole Salazar.
Your birthday?
January 2, 2004.
So for today, I will be doing, or I will assessing you the fetal heart rate. The purpose of this is to for monitoring measures the heart rate and rhythm of the baby to see how the baby is doing. So before doing the procedure, perform hand washing and provide a client's privacy. So ma'am, maghiga na po kayo. Drape the mother and expose the abdomen. Then, place the mother in dorsal position. So, ma'am, pwede po. Identify the fetal position and presentation carefully by performing the Leopold's maneuver. So, na-perform na po ito in the previous videos po. So, next is determine the fetal rate. Determine the fetal heart rate using the Penard stethoscope. Auscultate the fetal heart rate tones based on fetal presentation. Using Doppler transducer, So, let's assume po that this is a Penard stethoscope. So, after that, using Doppler transducer, place water soluble conducting gel over the transducer and turn the instrument on place. And place the transducer over the fetal back and move until you clearly hear the sound. Next is palpate the mother's radial pulse to see if it is synchronized with the sounds of the Doppler, and if so, try another location to get the fetal heart rate sounds which do not synchronize with the maternal pulse. Next is assist the FHR for 60 seconds. Average rate is 120 to 160 beats per minute. Then, report non-reassuring signs, FHR outside the normal limit, 120 to 160, and slowing of FHR that persists after the contraction, and further evaluation is necessary. Then, dry the abdomen of the client. Okay, so then, upo na po kayo. Then, after that, document the findings and perform hand washing. Good morning, ma'am. I'm Arañes, and today I will be doing I will be assessing the uterine involution. But before we proceed to the procedure po, may I know your name po?
Salazar.
Your birthday?
January 2004.
Okay, so the purpose of this po is to prevent postpartum hemorrhage. So before we proceed to the procedure, perform hand washing and provide clients privacy. So after applying gloves, assist the client into dorsal position. So ma'am, together po kayo. And then drape the mother and expose the abdomen. Then place a pad under the hip of the patient. So hip flex. Then, after that, place your hand above the symphysis pubis. Then, gently but firmly press into abdomen towards the spine and then slightly downwards towards the perineum until a mass is felt in the palm of the hand. Normally, the fundus descends 1 centimeter every 24 hours. Then, measure the number of finger breadth at which the fundus is felt below the umbilicus. If the uterus feels soft and baggy, perform light fundal massage. With gloved hand, release the perineal pad. Assess the amount, color, consistency of lochia. Then, offer perineal care if needed and provide a clean pad. Then, drape the exposed abdomen and assist the mother to lie comfortably. So, mamiga na po kayo. Then, record the following: level of the fundus, consistency of the uterus, position of the uterus, and then remove the gloves and perform hand washing.